So imagine you're just waking up in the middle of the night and it feels like your big toe is suddenly just filled with microscopic, jagged glass shards.
Oh, it is the worst.
Right. I mean, it is hot, it's swollen to like twice its normal size, and even just the weight of a thin bed sheet resting on your foot is completely agonizing.
Yeah, that is the classic textbook presentation.
And for centuries, doctors essentially told you this pain was, well, your own fault,
Yeah.
Like it was the inevitable punishment for a gluttonous
A
lifestyle.
whole disease of kings thing.
Exactly. But what if I told you those glass shards are actually the result of a 15 million year old genetic accident?
It's pretty wild when you actually look at the biology.
It is. So today we're taking a deep dive into the wildly misunderstood world of gout and uric acid. We've gathered clinical texts, historical documents, and the latest pathophysiology research for you, so we can really understand how a totally normal byproduct of human metabolism just suddenly turns into a weapon inside your joints.
Yeah, because gout is notoriously painful, and honestly, the sheer volume of misinformation surrounding it is just staggering.
I mean, people really don't understand it.
They don't. We are looking at an absolute masterclass in how our own immune system can, spectacularly overreact to a biological misunderstanding.
Right. And our mission today is to debunk centuries of those myths for you. But before we can just go ahead and blame evolution for all of this, we first have to understand what gout actually is on a microscopic level.
Yeah, and maybe more importantly, what it isn't.
Yes. So, clinically speaking, gout is an inflammatory arthritis caused by monosodium urate crystals depositing in and around your joints. And the classic spot, like I mentioned, is the base of the big toe. It's a presentation so distinct it actually has its own ancient name, right? Podagra.
Podagra, exactly. And the proximate cause of that inflammation is hyperuricemia, which is just a fancy way of saying a sustained elevation of uric acid in your blood.
Right, the blood is just too saturated.
Yeah, well, the physiological solubility limit of monosodium urate in body fluids, and this is assuming, normal body temperature and a normal pH, it's conventionally defined as about 6.8 milligrams per deciliter.
Okay, so 6.8, if we think about that visually, it's a lot like stirring sugar into a glass of iced tea.
Oh, that's a great way to picture it.
Yeah, you stir, and the sugar dissolves perfectly fine for a while, but eventually you just hit a physical limit.
Right, the saturation point.
Exactly. The liquid simply cannot hold any more sugar, and the excess just starts collecting as this sludgy sediment at the bottom of the glass.
That iced tea analogy captures the buildup perfectly.
Hmm.
But with gout, there's one really menacing twist.
Which is?
Well, in the body, when that urate hits the bottom of the glass, so to speak, it doesn't just sit there as a sludge. It crystallizes into these microscopic, needle-shaped spears.
Oh, literal needles.
Literal needles. But this brings us to a critical gap in the medical understanding. And honestly, it's one of the most frequently glossed over facts in this entire field.
The difference between the blood test and the actual disease, right?
Yes. Hyperuricemia, that high uric acid level, is absolutely necessary for gout to occur, but it is nowhere near sufficient on its own.
Meaning, just because your blood uric acid is reading, high on a lab test, it doesn't mean you automatically have gout.
Far from it, actually.
Yeah.
Large population studies consistently demonstrate that the vast majority of people walking around with uric acid levels well above that 6.8 threshold, they never develop a single attack of gout in their entire lives.
Wait, really?
Never. The crystals might actually be present. They can just sit there quietly, deeply embedded in the joint fluid of the cartilage, but they aren't triggering any inflammation whatsoever.
So they're just dormant.
Exactly. Because of this massive clinical gap, gout cannot be defined purely biochemically by just looking at a lab value. It has to be defined clinically by the actual presence of inflammation.
Okay, wait, I'm a little confused here. If someone's toe is huge, red, and throbbing, and their blood test shows high uric acid, why isn't that enough to just say, yep, it's gout? Because I was reading in the sources about this major institutional shift back in 2015.
Right, the ACR guidelines.
Yeah, the American College of Rheumatology, they changed their diagnostic gold standard. They basically downgraded the blood test, and now they want doctors to actually stick a needle into that agonizing joint to draw fluid out.
It sounds medieval, I know.
It does. Like, why force a needle into an already agonizing joint just to look at it under a microscope? I mean, that just sounds cruel to the patient.
It completely sounds cruel when you are the one in pain. But that mechanistic proof is crucial.
Why, though?
Well, for most of the 20th century, doctors diagnosed gout purely from the story. A patient comes in, says, my toe hurts, The doctor runs a blood test, sees high uric acid, and says, you have gout.
Which seems logical.
It does. But in 2015, the ACR and the European League Against Rheumatism shifted to a strict mechanistic standard. You have to physically aspirate synovial fluid from the joint and actually see those monosodium urate crystals under a polarized light microscope.
So you have to literally see the shards.
Exactly. Because, as we'll discuss later, there are other mimics out there that look exactly like gout, same red, swollen toe, but require completely different treatments. You have to prove the specific crystals are there to know what you are fighting.
So it's basically pics or it didn't happen.
Right.
We have to physically see the enemy.
That's a perfect way to put it.
Okay, so understanding that high uric acid is the necessary foundational ingredient, I guess the obvious next question is, well, where is all this uric acid coming from in the first place? And why are human beings so uniquely terrible at getting rid of it?
To answer that, we have to look at the daily realities of purine metabolism.
Yeah.
Purine, specifically molecules called adenine and guanine, are the literal building blocks of your DNA and RNA.
That A and G in the genetic code.
You got it. And every time a cell in your body naturally dies and gets replaced, which is constantly happening, those genetic letters have to be broken down and processed.
Right.
So through this whole chain of enzymatic steps, an enzyme called xanthine oxidase eventually converts these cellular breakdown products into uric acid.
Okay, so uric acid is basically the metabolic exhaust pipe for our dying cells.
Yes, exactly.
That makes perfect sense. But if it's mostly this internal genetic process, why does everyone think gout is just the punishment for eating too much steak or, drinking too much beer? Where did that moral judgment even come from?
Well, you can largely blame history for that, and specifically the selection bias of who was actually writing the history books.
Oh, of course.
We've known for centuries that rich diets play a role, but we grossly overestimated how much of a role.
Right, which brings up Benjamin Franklin.
Oh, yes. The famous essay.
I was laughing so hard reading this in the sources. In 1780, Benjamin Franklin was suffering from gout so badly that he wrote this satirical essay called Dialogue Between Franklin and the Gout.
It's a classic.
He literally personified gout as this demonic character who is just scolding him for his gluttonous, indulgent lifestyle. And historians love it as this early account of lifestyle risk factors.
But reading the modern science, Franklin was completely missing the real culprit.
Exactly. He was blaming his own gluttony while being totally unaware of this microscopic accident that happened millions of years before he was even born.
He thought it was a moral failing of his diet, when in reality it was largely a mechanical failing of his genetics.
Right.
And to understand that failing, we actually have to look back roughly 15 million years.
Okay, let's go back.
So in most other mammals like dogs, cats, mice uric acid isn't the end of the metabolic line. They possess a highly functional enzyme called uricase.
Uricase, yeah.
Uricase acts like a chemical shredder, breaking uric acid down even further into this highly soluble compound called allantoin.
Which just dissolves easily.
Perfectly. Because they have active uricase, most mammals literally cannot get gout. They just dissolve the waste and pee it out effortlessly.
But human beings can't.
No, we cannot.
Because 15 million years ago, a genetic mutation silenced the uricase gene in the common ancestors of humans and great apes.
Yep. It just turned it off.
We still carry the genetic code for it, don't we? But it's completely non-functional.
It's a pseudogene now.
So we are basically driving a metabolic car where the exhaust pipe was permanently sealed shut during the Miocene epoch.
That is exactly what happened. We lost the enzyme. And because of this evolutionary quirk, human baseline uric acid levels naturally hover dangerously close to that 6.8 solubility ceiling every single day.
Wow.
So diet, the purines from red meat, organ meats, or alcohol, that only modulates your baseline risk. It might nudge you over the edge, sure, but it is not the engine of the disease.
The engine is our kidneys, right?
Yes, absolutely.
Yeah.
The real drivers are genetic variants in your renal urate transporters.
The kidney pumps.
Right. Your kidneys handle about 2/3 of all uric acid clearance from your body. And when geneticists look at the DNA of hundreds of thousands of people, they repeatedly find that variants in specific kidney transporter genes account for most of the heritability of gout.
Genes with very catchy names, I'm sure.
Oh, very catchy. Things like urate1, SLC2A9, and EBCG2.
Rolls right off the tongue.
Doesn't it?
Oh.
But these genes control microscopic molecular pumps in your kidney tubes. If you have faulty variants of these genes, your kidneys basically under-excrete the urate.
So they don't pump it out.
No, they accidentally pump it back into your bloodstream instead of dumping it into your urine. Genetics explain far, far more of the variance in uric acid levels across the human population than diet ever could.
Okay, so that's under excretion, but can you also have overproduction? Like what happens if your cells are dying much faster than normal?
That absolutely happens, and it's actually a critical medical emergency in certain contexts.
Like when?
Well, if a patient has a condition where huge numbers of cells die rapidly, like in leukemia, or during something called tumor lysis syndrome, where chemotherapy destroys a massive tumor all at once.
Oh, wow. All those cells dying at exactly the same time.
Exactly. All of that DNA breaks down simultaneously. It releases this massive purine load into the blood, which the body then frantically converts into an ocean of uric acid.
That sounds incredibly dangerous. And if you want to see just how completely devastating the genetics can be, independent of any lifestyle choices whatsoever, the sources point to Lesch-Nyhan syndrome.
Yeah, it's a tragic but deeply illuminating condition.
I had never heard of it before reading this.
It was discovered in 1964. Lesch-Nyhan is an X-linked genetic disorder where baby boys are born completely missing an enzyme called HGPRT.
And what does that do?
Normally, HGPRT acts as a sort of cellular recycling plant for purines, salvaging them so they don't have to be broken down into uric acid in the first place.
Okay, so if the recycling plant is basically burned down from birth, all those raw materials just get dumped straight into the uric acid pathway.
Yes, and because of that, these infants produce massive, toxic quantities of uric acid from the literal moment they are born.
That is heartbreaking.
It really is. They develop severe gout and kidney stones as babies, which is decades before normal age-related gout would ever appear, alongside these devastating neurological issues and self-injurious behaviors.
It's definitive proof, right, of how critical this molecular pathway is, completely separate from what someone happens to be eating.
Unquestionably.
But medical science has actually figured out a way to temporarily reverse our evolutionary bad luck, haven't they?
They have, yeah. In 2010, the FDA approved an intravenous drug called pegloticase.
Pegloticase.
Right, it is literally a recombinant version of that uricase enzyme we lost 15 million years ago.
That is so cool.
Doctors can infuse the lost enzyme directly back into a human patient, and it immediately starts turning that backlog of uric acid directly into soluble allantoin.
So for patients with severe refractory gout that just hasn't responded to anything else, this must be a miracle.
It is. It can drop their serum urate levels dramatically within hours.
It is quite literally an evolutionary reversal delivered by an IV bag. That is wild.
It's amazing science.
All right, so we've established the genetic buildup. We understand the high uric acid and the broken exhaust pipe, but how do those silent crystals suddenly trigger an explosive, agonizing joint fire? And why does it always seem to go for the big toe?
Well, the location actually comes down to physical chemistry.
Chemistry.
Yeah, uric acid crystals strongly favor tissues that are cooler, more acidic, and less perfused with blood.
Okay, so the base of your big toe is pretty far away from the warm core of your body.
Exactly, making it a cooler environment where the liquid simply can't hold as much dissolved urate.
Just like the iced tea gets colder and the sugar drops out?
Precisely. The cartilage of the ear is actually another common cool target for the exact same reason.
Which makes total sense when you think about it. Now, the historical timeline of discovering what these crystals actually do is fascinating.
It took a really long time.
Yeah, because Antony van Leeuwenhoek, using those primitive lenses he crafted himself, first sketched these needle-like crystals from a chalky gout deposit way back in 1679.
Right, but he didn't really understand what he was looking at or how they actually caused the pain.
No, it was just a drawing of needles.
It took centuries to piece the rest of the puzzle together.
Mm.
In 1848, a physician named Alfred Baring Garrod proved the link between the blood and the joints with his famous thread test.
Oh, this was so clever. He literally dipped a linen thread into a gout patient's blood serum, added some acetic acid, and just watched the uric acid crystallize right onto the thread.
Right, proving the blood was completely saturated with it.
But it wasn't until 1961 that two researchers, Daniel McCarty and Joseph Hollander, finally proved the crystals actually caused the inflammation, right?
Yes, and they did it by utilizing polarized light microscopy.
And how does that work?
Under polarized light, monosodium urate crystals exhibit this very specific glowing optical fingerprint. They shine in distinct yellow and blue colors, depending on how you rotate the crystal.
Oh, wow.
Yeah, so McCarty and Hollander looked at fluid drawn from an acutely inflamed joint and physically saw these glowing, needle-shaped crystals sitting right inside the patient's own immune cells.
Which completely changed the medical paradigm. I mean, gout went from being this vague medieval disorder of bad humors to a modern, highly defined crystal deposition disease.
It changed everything about how we view it.
So what is exactly happening in the joint during one of these acute attacks?
It is a dramatic, highly destructive demonstration of your innate immune system.
Okay, walk me through it.
So resident immune cells in your joint space, which are called macrophages, they act like neighborhood security guards.
Right.
They detect these monosodium urate crystals and try to swallow them to clean them up. But the crystals are literally microscopic spears.
So they're eating spears. That can't go well.
It doesn't. This extreme physical cellular stress activates an internal sensor complex within the macrophage called the NLRP3 inflammasome.
Okay, I like to think of the NLRP3 inflammasome like a hyper-aggressive home security system.
Ah, I love that analogy.
Yeah, so the crystal is the burglar trying to break in, right?
That works perfectly. When the burglar trips the sensor, the inflammasome activates an enzyme called caspase-1.
Okay, so think of caspase-1 as the alarm wire being tripped.
Right. And instead of just quietly calling the police, the system decides the best response is to burn the entire house down to kill the burglar.
Exactly, it's total overkill.
Complete overkill. Caspase-1 cleaves a precursor molecule into its active form, which is a chemical messenger called interleukin-1 beta, or IL-1.
So if caspase-1 is the alarm wire, IL-1 is the literal chemical siren that goes off.
Yes, it deafens the whole neighborhood and calls in the immune system's SWAT team, this massive flood of white blood cells called neutrophils.
And that SWAT team violently rushing into the joint within a matter of hours, that is what causes the explosive heat, redness, and swelling you feel in your toe.
That is the exact mechanism of the flare. And understanding this specific immune cascade is crucial for knowing how to actually treat it.
Right, because you have drugs like colchicine.
Exactly. Colchicine is a very old medicinal derivative of the autumn crocus plant, used for gout for a long time, but it doesn't lower your uric acid at all.
Wait, it doesn't?
Nope. Instead, it works by disrupting the internal scaffolding, the microtubules, inside those neutrophils.
So it essentially paralyzes the SWAT team so they can't swarm the joint and cause the swelling.
Exactly. You are treating the fire, not the fuel.
Which brings us to a massive medical danger that we absolutely have to highlight for you today. If you are listening to this right now and you are currently suffering through a gout flare-up, this is the most important thing you will hear today.
Please pay attention to this.
Do not let anyone start you on a urate-lowering therapy, like allopurinol, during an acute attack.
Never, never, ever do that.
Why is it so dangerous?
Well, allopurinol works by inhibiting xanthine oxidase. It stops your body from producing new uric acid.
Which sounds good, right?
It sounds great in theory, but if you start it during an active flare, it causes a sudden, steep drop in blood urate levels.
And that's bad.
It's terrible because this sudden shift in concentration actually destabilizes the crystals that are already sitting in the joint, mobilizing them, and exposing fresh crystal surfaces to the immune system.
Oh, no.
You will literally pour gasoline on the fire. You'll drastically worsen and prolong the attack.
So the golden rule is always to treat the inflammation first.
Treat the inflammation, wait for the flare to completely resolve, and only then, very slowly, introduce long-term urate-lowering therapy.
That is such a vital piece of information. Okay, so because this biological mechanism was totally misunderstood for centuries before that 1961 microscope breakthrough, history is just littered with wild myths and mistaken identities, isn't it?
Unquestionably. I mean, one of the most persistent was the genius myth.
Oh, this one is so funny to me.
Right. For decades, there was a widespread belief that gout was a marker of high intelligence or genius, simply because historical figures like Isaac Newton and Charles Darwin famously suffered from it.
So people actually wanted it.
Kind of. Some Victorian doctors even speculated that uric acid was a brain stimulant, chemically similar to caffeine.
But it was just pure selection bias. History just happens to preserve the diaries and medical records of wealthy, elite men who could actually afford to eat the rich, purine-heavy diets that pushed their genetic risk over the edge.
Exactly. The poor people suffering from gout just didn't get biographies written about them.
The most fascinating myth, though, and honestly the one that totally derailed me when reading the sources, was Saturnine gout.
Ah, yes. Saturnine gout.
I couldn't believe this.
Yeah.
So the British aristocrats of the 18th and 19th centuries, they historically blamed their uniquely severe gout epidemics on drinking too much port wine.
Yes, port wine was the villain.
But the twist is, It wasn't just the alcohol or the purines in the wine, it was actually rampant lead poisoning.
Yeah.
They were drinking their wine from lead-lined vessels and actively using lead acetate as a cheap sweetener.
It's unbelievable, isn't it? This chronic lead exposure caused severe kidney damage, a condition called lead nephropathy.
Which physically destroyed the kidney's ability to excrete urate.
Exactly. So the famous disease of kings was actually just kings unknowingly poisoning their own kidneys with lead-sweetened wine.
They thought they were being delightfully gluttonous, but they were actually toxifying their own organs.
It is a striking historical vindication of the idea that diet alone doesn't tell the whole story.
Absolutely.
But even today, without the lead wine, gout is easily confused with neighboring conditions by doctors. Pseudo-gout is a perfect example.
Right, so if someone comes in with a swollen joint, how does a doctor know it's definitely gout and not pseudo-gout?
This is exactly why that needle aspiration from 2015 is so important.
Oh, to look at the crystals.
Yes, pseudo-gout is the closest clinical mimic, but it is caused by calcium pyrophosphate crystals, which are completely unrelated to uric acid.
And they look different.
Totally different. Under the polarized light microscope, they have a completely different optical fingerprint. Instead of needles, they are rhomboid-shaped, and they glow with a different color pattern.
Oh, that makes sense.
Pseudo-gout also usually attacks the larger joints, like the knees or wrists, rather than the big toe.
Okay, good to know. You also have tophi, which are those visible chalky lumps you sometimes see under the skin on a patient's ears or elbows.
Right, those are massive deposits of urate crystals from chronic, poorly treated gout over many years.
And we can't forget metabolic syndrome. There is a huge overlap between gout and diabetes, right? Because insulin resistance itself biochemically reduces the kidney's ability to excrete urate.
Which brings us firmly into the modern day.
Yeah.
We have solved the historical mysteries of lead wine and missing enzymes. But gout is not just some old disease from the history books. It is a rapidly growing modern epidemic.
It is increasing rapidly, specifically in high-income countries. We have an aging population, rising obesity rates, and much wider use of diuretic medications for blood pressure, which can also lower urate excretion.
Yes, but a major, highly debated driver in the modern diet is fructose consumption.
Fructose, like in corn syrup.
Exactly. This is a vital connection. Unlike glucose, which your body handles differently, the cellular metabolism of fructose requires so much rapid energy that it forces your cells to burn through their ATP stores.
And burning that energy does what?
Well, this metabolic burning directly generates uric acid as a physiological byproduct.
So highly sweetened beverages and modern high fructose diets are directly fueling this epidemic from the inside out.
They absolutely are. And this modern rise in cases has sparked a massive debate in the medical community about treatment protocols.
A pretty significant one.
Yeah. The American College of Physicians and the American College of Rheumatology still fundamentally disagree on how to handle asymptomatic hyperuricemia.
Meaning you have high uric acid, but no gout attacks.
Right. Say you go get a routine physical, and your random blood test shows your uric acid is 8.0, well above the 6.8 limit. But you've never had a single gout flare in your life.
Right.
Do you prescribe daily medication to lower it?
Because the drugs have side effects and costs, and as we established earlier, high uric acid alone doesn't guarantee you'll ever actually get a flare.
Exactly. The risk versus reward calculation is muddy, and it remains an unresolved philosophical question in internal medicine today.
But maybe the most mind-bending philosophical debate of all is why we lost that uricase enzyme in the first place.
Oh, this is my favorite part.
This is where the sources get into the Ames hypothesis.
Yes. So, in the early 1980s, a prominent biochemist named Bruce Ames proposed a really radical idea.
What was it?
He looked at the evolutionary timeline and asked, what if the loss of uricase in early primates wasn't just a random, unfortunate evolutionary accident?
What if it was on purpose?
What if it was an adaptation? Because chemically speaking, uric acid is a remarkably potent antioxidant.
Hold on, wait. You are telling me this molecule, the exact same one that acts like literal glass shards tearing apart my immune cells, it might actually be doing something beneficial for us.
That is the hypothesis. Ames pointed out that around the exact same time our primate ancestors lost the uricase enzyme, we also lost the genetic ability to synthesize our own vitamin C.
Which is another major antioxidant.
Exactly. Ames suggested that allowing uric acid levels to rise provided a vital replacement antioxidant shield in our blood against systemic oxidative damage.
So it might theoretically contribute to why human beings have relatively long lifespans and higher cancer resistance compared to our body size.
That's the theory. We basically traded the risk of joint pain later in life for a daily chemical shield that protects our cells from aging and mutating.
That is just incredible. Okay, so what does this all mean for you listening right now? If we distill this deep dive down, there are a few foundational things you really need to remember. First, high blood uric acid isn't a disease on its own. Those crystals actually have to trigger an immune alarm to cause gout. Second, you owe your vulnerability to a 15-million-year-old genetic deletion that just sealed off your metabolic exhaust pipe.
Yep.
Third, gout is a strict crystal deposition disease driven by that hyper-aggressive NLRP3 inflammasome we talked about. Fourth, when it comes to your baseline urate levels, your genetic kidney transporters matter far more than how much steak you eat.
So true.
And finally, if you are having a flare, never ever let anyone start you on allopurinol until the fire is completely out.
Those are the absolute clinical pillars of the disease.
Yeah.
But if we zoom out and connect all of this to the bigger evolutionary picture, to the Ames hypothesis, it raises a profound question to leave you with today.
I love this.
If Bruce Ames is right, and uric acid is actually a powerful antioxidant that gave early primates a crucial survival edge, then maybe hyperuricemia isn't just a failure of the human kidneys at all.
Oh, I see where you're going with this.
What if our bodies are deliberately holding on to this uric acid as a biological shield?
Wow.
And it only turns into a weapon, into those excruciating glass shards, when our modern fructose-heavy diuretic-filled environment pushes that ancient shield past its 6.8 milligram breaking point.
It completely reframes everything. It's not a moral disease of excess or gluttony. It is a disease of a protective biological system being pushed violently over the edge by the modern world. That exhaust pipe wasn't just sealed by accident. It might have been sealed to protect us. Thank you for joining us on this deep dive. Keep asking questions, and we'll see you next time.